Thank you, Valerie and Nikki. It's great to be here today. COVID-19 has created an extraordinary opportunity. The pandemic has been a major disruptive force on a global scale, but there may be a silver lining in that black cloud. Through the depths of the worst health crisis in living memory, COVID has highlighted the importance of everyday health, of both people and of the planet. Because to really understand health at its best, you need to understand health at its worst. Almost immediately, COVID brought to light the fragility of our own individual health. And it was a scary time for all of us. My wife, Kathy, and I live in London, and we decided to leave London to fly back to the US, to New Jersey, to be with my 3 daughters and parents. We thought we were leaving for 4 weeks or 6 weeks. We returned to London 12 months later. Felt extremely lucky to be close to family and friends at that time when a lot of people didn't have that luxury. And the lockdown impacted people in a very personal and individual ways. For me, on the one hand, it was amazing to have time to reconnect with my 3 adult daughters and my extended family. But I'm also somebody who really values relationship and connection, so being away from teams and colleagues was a different and very hard type of isolation. And during those early months, watching the news felt like you were watching a Hollywood disaster movie. The pandemic forced us to stop and think about our own health, about the health of others, and about the health of the planet as we scrambled to figure out how this pandemic could have happened. Overnight, we stopped taking our health for granted and started paying attention to prevention and how we can protect ourselves and keep ourselves healthy. Suddenly, a cough was no longer just a cough, and that hasn't changed. In fact, Global Scan's Health and Sustainability Living Study looked across 27 countries and found 63% of people will pay more attention to their health when the pandemic is over compared to when it started. And it didn't stop there. COVID shined a light on the disparities in access to health and on the impact inequality can have. As the world started to go into lockdown and societies cheered critical workers, we saw social drivers of health drive different health outcomes. There's plenty of research that shows ethnically diverse and low-income families were disproportionately suffering and dying from COVID. These communities often were least able to follow the socially distanced measures experts recommended. And there was an increased likelihood that these individuals couldn't work from home and less able to isolate at home when sick. To compound these issues, those living in deprived areas tend to have underlying health conditions like diabetes. According to the National Library of Medicine, all these reasons are rooted in structural inequality. And as the world started to ask how COVID could have ever happened, it highlighted one simple truth. People can't be healthy if we live in an unhealthy world. Things like nature loss from deforestation and increased pollution are taking their toll on the planet's health, and in turn in our health, with climate change aggravating the situation. The UN Global Impact report published earlier this year said 1/4 of global disease generated is from environmentally related risks. These are things like exposure to air, water, and soil pollution. In fact, the WHO data shows 99% of the world's population is currently breathing air that exceeds their guideline limits. That one problem results in 7 million excess deaths every year. But how many of us noticed that before COVID? And here's the silver lining. COVID disrupted our way of life, made us stop and think and pay attention, forced us to think about the relationship with health and what we could and should do differently. It gave us a preview of the benefits of change. Air pollution levels plummeted. We saw skies clearing in cities around the world. It also showed us humanity's incredible capacity for change and action. So in the long run, it may have helped us help ourselves. At GSK Consumer Healthcare, we're in a unique position and have a terrific opportunity to have an impact, because we use health as the lens to look at everything that we do. And we're already taking steps to help solve the issues that are impacting people's health. We strongly believe in educating and empowering people to take control of their own everyday health. Through our brands and partnerships, we reach over 3 million healthcare professionals a year. This includes dentists, pharmacists, and doctors. Every single day, those healthcare professionals reach millions more people, providing trusted advice. It's simple. The more people we reach, the more we help people take control and manage their own health. And this is not just about coughs and colds. It's about understanding the power of proper care and prevention. Studies, including one by Ipsos just earlier this year, increasingly demonstrates the link between poor oral health and systemic disease, including diabetes, cardiovascular disease, as well as links to complications in pregnancy. As leaders in oral health, we reach a quarter of the 2 million dental professionals in the world. Through our relationships and our brands like Sensodyne and Parodontax, we're helping over 400 million people a year understand the health benefits that come from taking simple steps to look after your oral health. I also appreciate this may only help those that have access to a healthcare professional or trust a healthcare professional. But we are committed to driving more inclusive and better everyday health for everybody. It starts with understanding and overcoming the challenges in a way of everyone being able to have equally access to better everyday health. But actions speak louder than words, and we are committed to action. We're creating partnerships with academics and media leaders, bringing together disparate groups to develop better everyday healthcare solutions. One example is our partnership with the Economist Intelligence Unit to establish the first ever healthcare Inclusivity Index. The index will drive deeper conversations with policymakers, healthcare professionals, and consumers to effectively measure healthcare systems' ability to globally deliver and drive self-care and identify ways to improve. We're going to talk a lot more about that in 2022. But we're not stopping there. Our brands reach over 1.5 billion consumers every year. We truly appreciate the extraordinary opportunity this gives us to understand and support 1/7 of the world's population. And we take this very seriously. For example, following a study of 2,000 Americans conducted by one poll, we found 58% of working people avoided calling in sick for fear of being reprimanded by their employer. Even worse, we found that Black and Latina women are 10% more likely to avoid calling in sick. Rest and recovery should be a right, not a privilege. So in partnership with the Good Plus Foundation, Theraflu has launched the Rest and Recovery Fund. This fund helps cover lost wages from unpaid sick days and supports parents so they can take a day to rest and recover from illness. Finally, we have to think about our planet. People can't be healthy in an unhealthy world. And we all got to play our part to responsibly protect the environment. So like most companies, We're aware of the role we play in tackling climate change and have set aggressive environmental targets to run our business in a responsible way. But as healthcare experts, we feel like we're in a unique position to play a bigger role in educating and addressing the impact of climate change on health. So, what is the world's largest environmental threat? It's air pollution. To help raise awareness of the benefits of clean air, in 2020, we collaborated with Ecologic Studios and Copernicus Science Center to build the ultraviolet air bubble on a playground in Warsaw, one of the most polluted cities in Europe. It's the world's first biotech educational exhibit designed to reduce air pollution inside the bubble to give children an opportunity to breathe clean air while they play, and to demonstrate the intersection between good health and a healthy planet. The air bubble has created a lot of discussion. It's currently featured at COP26 in the UK right now, and is starting to help people understand the benefits of clean air. As we look at the impact of COVID has had across the world, reminds me of an Albert Einstein quote: "In the midst of every crisis lies great opportunity." This has been an immeasurable crisis, where the impact will be felt for years to come. But it has also given us an opportunity to come together, to learn from crisis, and to truly focus on delivering healthcare at its very best. But none of us can do this alone. My hope is each person prioritizes how much we can access, understand, and ultimately maintain good health and well-being. And for companies and governments, there is a chance to play an important role in redefining self-care for the long-term benefits of individuals, societies, and the planet. At GSK Consumer Healthcare, we know we are in a unique and privileged position. We see and help address these social and environmental barriers which stand in the way of good everyday health. And we are committed to using our human understanding, trusted science, and global scale to deliver better everyday health with humanity. There will always be more to do. So my simple ask, that we all identify and commit to what more we can do today to protect tomorrow. Because behind every cloudy sky is a blue sky. Thank you.